Hello everyone, I am Marlon Cinco from Group 2 and I will be discussing what a musculoskeletal disorder is. So a musculoskeletal disorder refers to the performance of the locomotor system compromising intact muscles, bones, joints, and adjacent connective tissues. So a musculoskeletal impairments comprise more than 150 different diseases or conditions that affect the system and are characterized by impairments in the muscles, bones, joints, and adjacent connective tissues, leading to temporary or lifelong limitations in functioning and participation. So next, I'm going to be talking about the musculoskeletal parts and its conditions. So first, we have the joints, and its specific conditions consist of osteoarthritis, rheumatoid arthritis, psoriatic arthritis, gout, and spondyloarthritis. Next, we have the muscles, which consists of a specific condition called sarcopenia. And third, we have the bones, and its specific conditions consist of osteoporosis, osteopenia, and associated fragility fractures and traumatic fractures. Lastly, we have the multiple body areas or systems, such as regional and widespread pain conditions, inflammatory diseases such as connective tissue diseases and vasculitis that have musculoskeletal manifestations. For example, the systemic lupus erythematosus, or amputation as a result of disease or trauma.
So here I'm going to present about the roles of bones, muscles, and joints. Bones, basically, human body moves just because of bones, because bones collectively work with the muscles and joint, and they hold our body. So the bones also protect the internal organs like heart, liver, or lungs from injury. Muscles help our body move and function well. So muscles can be smooth, cardiac, or skeletal muscles. Joint Joints basically connect between the bones. When two or three bones connect, that make a joint and allow our body to move. So the joint can be fibrous joint, synovial, and cartilaginous joint. Prevalence of Prevalence of musculoskeletal disorder in Australia. According to According to 2022 Australian Bureau of Statistics National Health Survey (NHS), around 7.3 million, that is more than one quarter, 29% people in Australia were estimated to be living with chronic musculoskeletal conditions. However, these statistics has not been changed since the last survey, which was done 2017 and 2018.
So in addition to that information, around 4 million or 16% of the Australians were estimated to be living with back problems. 3.7 million or around 15% were estimated to be living with arthritis. And lastly, around 854,000 or 3.4% of Australians were estimated to be living with osteoporosis or osteopenia. So shown below me is a figure of the prevalence of chronic musculoskeletal conditions by age and sex over time around 2001 to 2022 by population group. So as you can see, around 26.8% of males were estimated to be living with the musculoskeletal conditions. Around 30.8% of females were estimated to be living with the musculoskeletal conditions. And around 28.8% of persons were estimated to be living with the musculoskeletal conditions.
Next is the treatment for the musculoskeletal disorder. However, the treatment is depend on the different factors such as age or what is the condition of the that disorder. However, most common approach is used is the medication. So some painkillers and pain reliefs are used by the people to relieve the pain. Hand-on therapy and complementary therapies are also helpful. Apart from it, aids and devices such as uh, walking frame, which are used by old people so that they can easily move when they having especially knee pain. Surgery is used to replace or repair the particular joint. Lifestyle modification can also helpful by adopting some healthy and good diet and adding some exercise in their daily lifestyle. Education and self management, again, it is very helpful for the patient when the patient is self aware about their lifestyle, and they can change something bit differently.
Now I will take us deeper into the topic by exploring specific musculoskeletal disorder treatment. While there are many musculoskeletal disorders, I'll focus on three examples: arthritis, back pain, and bursitis. Let's begin with arthritis. For arthritis treatment, the approach depends on the specific type of arthritis you have, which joints are affected, and your individual symptoms. First, we have medication, which may include pain relief medicines to manage discomfort and anti-inflammatory medication that help reduce swelling and pain. Next, there's the option of surgery. In some cases, surgery may be recommended to replace or repair damaged joint, especially when other treatments haven't provided enough relief. Lastly, consider other treatments. It can be helpful to work with various health professionals, like physiotherapists, occupational therapists, exercise physiologists, or podiatrists. They can offer specialized support and strategies to improve your daily life. Now let's discuss the treatment for back pain. Most episodes of acute back pain actually pass on their own without any special treatment. However, if you're experiencing persistent pain, your doctor may prescribe medication to help relieve short-term discomfort. This could include oral anti-inflammatory medicines or topical anti-inflammatory treatments, like cream, gels, or patches applied directly to the skin. There are also several proactive steps you can take to minimize and manage back pain, especially if it tends to recur. For starters, keeping physically active is crucial. Resting your back can often make your pain worse, so staying active can help relieve symptoms and improve sleep. Maintain a healthy weight is also beneficial, as it reduces the load on your spine. Additionally, if you smoke, consider quitting. Smoking has been linked to an increased risk of back and neck pain. Managing your stress level is important too. Stress can worsen the pain by increasing muscle tension and spasm. Techniques like mindfulness meditation have been shown to help reduce pain level. Next is the treatment for bursitis. Bursitis is an inflammation or irritation of the small fluid-filled cushion called bursae that protect tendons where they touch the bones. Fortunately, bursitis can often be treated at home, especially if you can avoid the activity that triggered it in the first place. A common approach for treating bursitis is the RICE method, which includes resting the affected area, applying ice pack to reduce inflammation and pain, using compression with bandage to decrease swelling, and elevating the area to minimize swelling. Over-the-counter pain relief medication can also be very effective. Ibuprofen and other non-steroidal anti-inflammatory drugs can help manage pain and reduce swelling. If home treatments don't bring relief, a doctor or physiotherapist may suggest a gentle exercise and stretches, or even a brace to provide support. For severe pain that doesn't respond to this treatment, your doctor might refer you to a specialist radiologist for a corticosteroid injection directly into or around the bursa, which can provide significant relief. In some cases, if the bursitis is particularly persistent or severe, your doctor may recommend surgery to remove or drain the bursa.
The charity and organizations in Australia for chronic musculoskeletal disease, including Musculoskeletal Health Australia, Arthritis Australia, and the Hospital Research Foundation Group, support people with arthritis and musculoskeletal conditions. They provide consultations, self-care strategies, community programs, support groups, education, research, and access to NDIS and MyHealthcare, improving quality of life and managing pain.
Myself Shurey, and now I am explaining the annual event related to the musculoskeletal disorders. And 28th of the January, we celebrate World Leprosy Day. 7th of April, World Health Day. 10th May, we are celebrating World Lupus Day. And 20 May to 31st May, it's a Spinal Health Week. 21st of Jan, it's International Day of Yoga. 22 July to 28 July, it's a National Pain Week. And 29 October to 15 January, Pediatry Week. We celebrate these days to get awareness about the musculoskeletal disorders.
Alright, so I will be talking about the assessments for musculoskeletal conditions. So the first one is visual analog scale. So in this one, it is a subjective measure for pain intensity where patients rate their pain on scale from 0 to 10. So 0 is the no pain and 2 means medium pain, 5 means moderate, and when it comes to 10 it means it is very painful for the patient, and it is commonly used in clinical settings to track changes in pain over time. So the another one is the another assessment is range of motion test. So in this test we just tell the patient to do some flexibilities or some motions. So some of them are flexion, extension, rotation, abduction, and some etc. And so it measures the degree of movement around the joint using a gynometer, and it helps assess flexibility and joint functions of the patient. Alright, so the third one is strength testing. So in this thing, there is a dynamometers we will just hand over to the patient, and it evaluates muscle strength, often using handheld dynamometers. So when we'll see when the patient will grip it and hold it tightly, so we will just know the strength of the patient in his hands, and it determines the functional ability of muscles and identifies weakness. So the another one is functional test. So in this thing, it assesses mobility, balance, and endurance of the patient. So it provides insight into a patient's daily functional capabilities. So for example, the patient will sit on the chair and he'll stand up and he'll just walk for 3 meters straight, and he will turn around to the same place he started. So in this thing, we'll see if he is in a balanced position, and how was his movement. So the last assessment is patient reported outcome. So the score 0 to 10 means level of disability is minimal, so 20 to 40 is moderate, 40 to 60 is severe, 60 to 80 is crippled, and 80 to 100 is bedbound. Questionnaires that capture the patient's perspective on pain, function, and quality of life, useful for evaluating treatment outcomes and guiding management decisions. For example, post-vestibular disability index.